Namaskar, my dear students. Today in the dental materials section, we will be covering a very important material, that is glass ionomer cement. It is one of the most widely used dental cements and it is very important theoretically also. Okay, so we will be covering every aspect of this cement and the important questions related to it. So let's begin. What is a dental cement? As we discussed in our previous video also, that dental cement is a substance that hardens to act as a base, liner, filling material or an adhesive to bind the devices and the prostheses to the tooth structure or to each other. We have already discussed the classification systems of dental cement in our previous video, and we have also discussed in detail zinc phosphate and zinc polycarboxylate cement. So in this video, we will be including glass ionomer cements in detail. To begin with, the glass ionomer cements, the usable form of glass ionomer, commonly known as GIC, was formulated in 1972 by Wilson and Kent. It is one of the questions which is asked in Viva, and it is one of the multiple choice question also. Now, glass ionomer cement is adhesive tooth colored cement. It binds with the tooth with due to the ionic bond. Okay, then it has anti-cardiogenic property which makes it unique and a very beneficial property. It is one of the very popular and widely used cement because it is biomimetic, which means that its properties, mechanical properties, are similar to dentine. Okay, then the synonyms or the other names of glass ionomer cement are polyalkylate cement and ASPA, which is aluminosilicate polyacrylic acid based on its composition. Now, glass ionomer cement, why it is named like this? Because the powder is a type of glass. And second, the setting reaction or the adhesive bonding to the tooth is due to the ionic bond, as I just told you. Now we come to the classification of the glass ionomer cement. The glass ionomer cement, according to Wilson and MacLean, they can be divided into three types. Type 1, luting and bonding agent. These types are mainly used for cementation of the crowns, bridges, inlays and the orthodontic appliances. Type 2 are the restorative cements. As from the name, they are used for restoring in the aesthetic zone, mainly class 3, class 5 restorations. And in the less aesthetic zone, they are used for the posterior restoration or as a core build-up material also. Then type 3 are the lining and the bases. They are mainly used as liners or bases. The next classification is based on the uses, the proposed application. In this type 1 are the luting cements, again used for the luting of crowns, bridges, inlays, onlays. Type 2, they are used for as a restorative material both in the aesthetic and the non-aesthetic zone. Type 3, they are used for as a liner and bases. Type 4, to a limited extent, but yes, they are used as Pitt and Fisher sealants also. Type 5, they are used as orthodontic cements. Type 6, as a core buildup material. Then type 7 for the caries stabilization and a preventive material because of their anti-cariogenic property. Type 8, they are interior ART material. What do you mean by ART? ART is atraumatic restorative treatment. In this, the decalcified tissue is removed by only using the hand instrument. Okay, then it is restored with the glass ionomer cement. Type 9 as a posterior ART material, mainly used in the geriatric and the pediatric patients. The newer classification of the glass ionomer cement, it also involves its modifications. So according to this, it can be the traditional glass ionomer cement, as we just discussed, divided into three types. Type 1 luting, type 2 restorative and type 3 liners and bases. Then comes the metal modified glass ionomer cement, which can be the miracle mix or cermet cement. Third are the resin modified glass ionomer or the hybrid ionomer cements. So we will discuss them one by one. Composition of the glass ionomer cement. It is mainly available in the powder and the liquid form. The powder is an acid soluble calcium fluoroaluminosilicate glass. Okay, because of its glass content, it is called as the glass ionomer cement. It is similar to the silicate cement only, but it has a higher alumina is to silica ratio. Okay, so if we go to the percentage, silica is 41.9%, alumina 28.6%, aluminum fluoride 1.6%, calcium fluoride 15.7%, sodium fluoride 9.3%, aluminum phosphate 3.8%. This fluoride portion, it acts as a ceramic flux. Okay, so this is important. Then apart from this, the lanthanum, strontium, barium, they provide the radio opacity. Okay, now next is the liquid. Liquid, previously it was just a 50% aqueous solution of polyacrylic acid, but now the liquid contains the polyacrylic acid in the form of copolymer with the itaconic acid and the malic acid. Now, what is the benefit of this copolymerizing it with other acids? It increases the reactivity of the liquid and it decreases the viscosity. Okay, it reduces the tendency of the liquid to make a gel. Okay, then second is the tartaric acid. It improves the handling properties. It increases the working time. Third is water. Water is the very important constituent of the liquid. It acts as a medium of reaction, number one, and it also hydrates the reaction product. The amount of the water in the liquid is very critical. Next, we come to the setting reaction of glass ionomer cement. Very important. First of all, when the powder and the liquid they are mixed together, the acid attacks the glass particles. The calcium, aluminium, sodium and the fluoride ions, they leach out into the aqueous medium. This is called as leaching. Then second, what happens? The calcium ions, they start cross-linking with the polyacrylic acid chains and they form calcium polyacrylate gel. Third, the aluminium cross-links take place. The aluminium, they begin to cross-link with the polyacrylic acid and they form aluminium polyacrylate gel. Then what happens? The sodium and the fluoride ions, they do not take part in the cross-linking, but they form sodium fluoride, which is uniformly distributed within the matrix, within the cement. Okay. Then the water plays an important role. The hydration takes place. Okay. The maturation of the gel takes place with the help of water, which adds strength to the cement. And last, the silica gel sheath is formed. The unreacted glass powder particle, it is sheathed or covered by a silica gel. Okay, and this hydrated gel is formed by the ions of calcium, aluminium, sodium fluoride from the glass particles. Now let us discuss the role of water in the setting of glass ionomer cement. As we just discussed that water plays a critical role in the setting of glass ionomer cement. The water content, it can be divided into the loosely bound water and the tightly bound water. Loosely bound water is easily removed by dehydration, while the tightly bound water, it cannot be removed and it remains an important part of the set cement. Okay, it forms in the gel. What is the role of this water? It serves as a reaction medium initially and then slowly it hydrates the cross-linked matrix. Okay, it provides stability to the gel structure that is stronger and is less susceptible to the moisture. Mechanism of adhesion, if we talk about the glass ionomer cement, they adhere well both to the enamel and the dentine. The glass ionomer, they bond chemically to the tooth structure and the bonding is due to the reaction between the carboxylic groups of the polyacids and the calcium of the hydroxyapatite in the enamel and the dentine. Okay, now if we talk about the strength, bonding with the enamel is higher than the dentine. Why? Because of the inorganic content of the enamel and its homogeneous structure. Okay, now the shear bond strength, it ranges from 3 to 5 megapascals. Now we come to the manipulation. The steps in the manipulation are: first is the surface preparation, that is the preparation of the tooth surface. Second is the preparation of the material, that is its proportioning and its manipulation, mixing. Third is the placement of the material and then removal of the excess. Then is the finishing. The surface finishing is very important without excessive drying of the material. And last is the protection of the restoration surface. So let us discuss them one by one. The first step is the surface preparation, that is the preparation of the tooth surface. In this, first, a pumice slurry, it can be used to remove the smear layer. A cotton pellet can be used with a pumice slurry. The smear layer is formed after the cavity preparation, which is very important, and it should be removed. Then second is that tooth surface can be conditioned with 10 to 20% solution of polyacrylic acid or 37% phosphoric acid also. Okay, this conditioning is done for about 10 to 20 seconds and then the rinsing is done for 20 seconds. Okay, what is the advantage of surface preparation? Why we are doing? First, as we talked, that the smear layer has to be removed. And second is, it enhances the wettability of the tooth surface. And third, it also pre-activates the calcium and the phosphate ions in the dentine for good bonding. Next is the preparation of the material. For the preparation, first is the powder liquid ratio. For the restorative cement, the powder liquid ratio should be 3:1, and for the luting cements, it should be 1.8:1. For the mixing, we need a paper pad and a gate or the plastic spatula. Then the powder and the liquid, it should be dispensed just before the mixing. It is very important because prolonged exposure to the atmosphere, it can change the acid water ratio of the liquid. Okay, then the powder, it should be divided into two increments. The first increment is incorporated into the mix with a spatula, and then the material is mixed with a swiping and folding technique. Okay, it should not be spread to a larger area like the zinc phosphate. The mixing time should not exceed 45 to 60 seconds. Okay, now when we are mixing, at this time the mix should have a glossy appearance, okay, which indicates that unreacted polyacids are present on the surface. If it is a dull appearance, that means that inadequate free acid is present for bonding. Okay. Next, we come to the placement of the material and removal of the excess. While placing, we have to check that the mixed restorative cement has a glossy appearance, as just I told you. Then this restorative cement mixture should be applied by a plastic filling instrument. Okay, the tooth cavities, they should be slightly overfilled with the cement so that they can be contoured properly. After placement, the surface should be covered with the pre-shaped plastic matrix which are available. This is very important because this protects the cement from the environment, okay, from losing or gaining water during the initial set. The matrix is left in place for at least 5 minutes, and then after removal of the matrix, the excess material should be trimmed off from the margins. Next is the surface finishing. After removal of the excess material, we will use the hand instruments to do the initial finishing. Okay, we will not use the rotary tools because it can cause ditching. Okay, and the final finishing, it should be done after 24 hours. The last step, which is very important, is the protection of the restoration surface. You know, the protection of the cement after setting. Okay, we can do the protection with the following things. First is the varnish. We can use a special varnish which is also supplied by some of the manufacturers, or we can use an unfilled light cure resin bonding agent, or third, very commonly available cocoa butter or petroleum jelly can also be used. Okay, now why this protection is done? This protects the cement from drying while we are doing the finishing procedure. Okay, otherwise what will happen? It will lead to a chalky or crazed surface. So it should be protected after the restoration is complete. Next, we come to the physical properties. First is the compressive strength. If we talk about the glass ionomer restorative, they have a compressive strength of 130 to 150 megapascals. Then the luting GIC or the base and the liner GICs, the compressive strength is 70 to 85 megapascals. Okay, then comes the setting time. Setting time for the restorative and the luting cement, it ranges from 2.5 to 8 minutes. Okay, now we come to the hardness. Hardness of the glass ionomer cement is around 49 Knoop hardness number, which is lower as compared to the composites. Now, next comes the fracture toughness. Fracture toughness is again inferior to the composites. Elastic modulus, which is 7.3 GPa. It is almost half of the zinc phosphate cement. And at last, very important property, wear resistance. Glass ionomer cements, they are susceptible to the toothbrush abrasion and the occlusal wear as compared to the composites. If we talk about the film thickness for the luting and the base and the liner is around 25 micrometer. Next, we come to the biological properties of the glass ionomer cement. If we talk about the pulpal response of GIC, it is considered as mild. Okay, but they elicit a greater pulpal reaction when compared to the zinc oxide eugenol cement. But it is generally less than the zinc phosphate cement. Why? Because the polyacids present in the GIC, they are relatively weak acid. And if we compare amongst the types of the GIC, the type 1 glass ionomer cement, which is luting, is considered more acidic as compared to the type 2, that is the restorative GIC. Okay, now if we talk about the deep cavities, the pulpal protection part, if the remaining dentine thickness is less than 0.5 millimeter, then a thin layer of calcium hydroxide should be placed as a liner for pulpal protection. Okay, next we come to the fluoride release. The glass ionomer cement, they release fluoride in amounts which is comparable to that of the silicate cement. And they also continue to do so over an extended period. And it has also been seen that the fluoride ions which are released from the GIC, they inhibit the progression of the secondary caries. Next, we come to the advantages and disadvantages of the glass ionomer cement. First are the advantages. The main advantage is that inherent adhesion to the tooth surface, which is the chemical bonding. Second, they create a good marginal seal. Third, the anti-cariogenic property, the fluoride releasing property of the glass ionomer cement. Then biocompatibility. Last is the minimal cavity preparation which is required for the glass ionomer cement. As we just discussed that in the atraumatic restorative treatment, it can be used. Now coming to the disadvantages, first is the low fracture resistance. It has poor physical properties, low wear resistance, then water sensitive during the setting phase, which is very critical. And last, very important, less aesthetic as compared to the composites. Now we come to the modifications of the glass ionomer cement. In this we will be discussing three modifications. First is the water settable glass ionomer cement. Second is the resin modified glass ionomer cements. And third are the metal modified glass ionomer cements. The first are the water settable glass ionomer cement. In this, the liquid is delivered as a freeze dried form and it is incorporated into the powder itself. And the liquid which is used for mixing is the clean water. Next are the resin modified glass ionomer cement. As from the name itself, the glass ionomer cement which are being modified by the resin particles. If we talk about the composition, the powder mainly consists of the iron leachable fluoroaluminosilicate glass, then photoinitiators for both light curing or the chemical curing, then the polymerized resin. The liquid contains the polyacrylic acid, water, and the methyl methacrylate monomer. Along with it, it contains hydroxyethyl methacrylate monomers, that is HEMA. These are the components which are responsible for the polymerization. The resin modified glass ionomer cements, they are supplied in three forms. First is the chemical cure, in which the acid base setting reaction takes place. And second is the dual cure, which combines the acid base setting reaction of the GIC and the light curing of the resin portion. Third is the tri-cure, which combines the acid-base setting reaction of the GIC and the polymerization of the resin portion. It takes place by both the chemical and the light curing process. Next we come to the setting reaction. The setting, as we discussed, that setting includes both the polymerization of the resin and the acid-base reaction. The initial setting occurs by the polymerization of the methacrylate groups, and subsequently the acid-base reaction takes place. Coming to the properties of the resin modified glass ionomers, first is the strength. The compressive strength is lower as compared to the conventional GIC, while the tensile strength is more as compared to the conventional GIC. Next is the adhesion. The bonding mechanism to the structure is similar to the conventional GIC, while the micromechanical retention also plays an important role, just like composite resins. Then micro leakage. Micro leakage is greater with the resin modified glass ionomers. Why? Because of the polymerization shrinkage of the resin portion. Then anti-cariogenity, these materials have significant anti-cariogenic effect because of the fluoride release. Then pulpal response is considered as mild, which is just similar to the conventional GIC. Aesthetics, they are more translucent and thus they are more aesthetic than the conventional glass ionomer cements. Next, we come to the uses or the applications of the resin modified glass ionomer cement. First, they are indicated for the permanent cementation of the porcelain fused to metal crowns, bridges, onlays, inlays, all ceramic crowns, and also the luting of the orthodontic appliances. Second, they are used as adhesive liners for the amalgam. They are also used as high strength bases. In some cases, they are also used as provisional restorations. Next are the compomers. These are the polyacid modified composite or the compomers. Compomers contain more composite, okay, which are modified by the polyacids. These material have the fluoride releasing capability of the conventional glass ionomer cement and the durability of the composites. It mainly contains the silicate glass particles, sodium fluoride and the polyacid modified monomer without any water. Very important. Now, if we talk about its uses, it is used as restorative material in periodontics. Then it is also used as restorative material in non-stress bearing areas in class 5 lesions. They are also used as bases and luting agents. They are mainly supplied as either a single paste, which is light cured, a powder liquid system, or a two paste auto mix systems. Next are the metal modified glass ionomer cement. Right from the name itself that the glass ionomer cement is modified by the metal particles. They act as filler particles to improve the strength, fracture toughness and the resistance to wear. Okay, now this can be modified by two types. First is the silver alloy admix, which is popularly called as the miracle mix. This is made by mixing the spherical silver amalgam alloy powder with the glass ionomer powder. And second is the cermet. In this, the silver particles, they are bonded to the glass ionomer particles by fusion through the high temperature sintering. Now it is also called as the Kitak silver. Okay. Now coming to the uses, they are basically used for the class 1 cavities in the posteriors, and they are also used for the core buildups of the grossly disrupted teeth.
Coming to the properties of the metal modified GICs, it has been observed that the mechanical properties are just similar to the conventional glass ionomer cement. The strength, the diametral tear, tensile strength, fracture toughness, it is all similar to the conventional GIC. Coming to the anti-carcinogenic property, less fluoride release is released from the ceramic cement. Then coming to the aesthetics, because of the addition of the metal particles, it gives a gray color. So that is why it is unsuitable for the interior teeth. So that's all for this topic on glass ionomer cement. I'm sure this video will really help you to solve all the theory questions as well as the multiple choice question. Do not forget to share and like the video with your friends and your juniors. You can give your topics in the comment section. I will try to cover them in the next videos. Wish you success today and always.